extensor epicondyle elbow. And in fact, it was so bad, he'd had it for so long that he lacked about 7 or 8 degrees fully extending his elbow. He had a lot of scar tissue in the elbow. He continued to play tennis, but was in a lot of pain. We became aware of this type of treatment, treated him, and used him as a test case. And of course, he's been in the business a long time and very cynical, and so we felt like that would probably be a fair test. We treated him once with the treatment, and I spoke with him the next day, and he actually reported that within 20 or 30 minutes after the treatment, he had become pain-free. And we measured his elbow range of motion the next day. It was completely full. And to my knowledge, he's continued to play tennis without any discomfort since we treated him once or twice with the deep tissue oscillation type treatment. If I were in the dealer's position, if I could go to a clinic and treat a total knee that was maybe 3 to 4 days post-operative, then I would probably pay someone to let me do that. Because the pain relief that patient will experience, the increased motion they'll experience, and just visually looking or circumferentially measuring the amount of edema that will be reduced by a 10 to 15 minute treatment is remarkable. And I love total knee patients since I've started to use the deep tissue oscillation, because they just do so well. So well, in fact, and I hate to say this, but it's the truth. We have total knee patients who are driving 50 miles or more to come to our clinic to be treated with this, because the word's out how much pain reduction. In this case, the electrical field that's established in the operator and in the patient are constantly alternating. And as they do, the charges associated with the matter in the patient's body that we're treating is either drawn to the charge in the operator or repelled from the charge in the operator. And this basically just causes the tissue to be pushed and pulled or vibrate. The result of that on the soft tissue is something that probably could be categorized, and I'm just kind of making this term up as I go, but it could be categorized as maybe a micro, like a massage at the cellular level. The situation, we have a total knee replacement. Picture Matt with an incision, something like this, and he's got a lot of swelling around his knee. Most of the time, the swelling will be greater medially than it is laterally. We never say forever, but what I would do is I would work the area where the greatest amount of swelling. As I can feel now where the fluid is accumulated, and I'm going to work and milk basically that fluid forward. Now, anyway, he got kicked real good right in his mid-back, and he has a hematoma here, and of course, a lot of associated muscle spasming, and it's real tender. In my opinion, this treatment has so much greater circulatory effect than either the light or ultrasound that they shouldn't even be compared to